Hi, I'm Dr. Emily Poccia, naturopathic doctor and owner of Wildcraft Medicine in La Jolla, California. I'm here today to talk to you guys about thyroid health and how it relates to fertility. So first, let's start with what the thyroid gland is. The thyroid gland is an endocrine or hormone gland that's located in the base of our neck and responsible for all things metabolism. So it supports cellular energy, protein synthesis, it helps us regulate our body temperature, and so forth. We can have issues with thyroid where we either under or overproduce thyroid hormone. So let's talk a little bit first about what happens when we underproduce thyroid hormone. This is a condition called hypothyroidism. As expected, you'll see a slowing down of metabolism. So you'll see weight gain, you may see hair falling out as it's harder to keep up with hair growth. The cells of the skin are not turning over as quickly, so you'll get dry skin. You may get slowing down of the digestive tract, and that can lead to constipation. People may get brain fog and cognitive issues or issues with memory as brain functioning is slowing down. You may feel fatigued. You may notice that you're cold all the time and have a hard time regulating your body temperature. And a lot of women with hypothyroidism also have heavy menstrual cycles. So let's talk about how thyroid is related to the reproductive tract. When you're underproducing thyroid hormone, as to be expected, your reproductive tract is also going to suffer, as well as other hormones related to sex hormones. We release something called LH, or luteinizing hormone, in healthy reproductive aged women. Mid-cycle, there's a surge or a spike of LH that's released from the pituitary in the brain down to the ovaries, and this is a signal to the ovaries to release an egg. This is called ovulation and how we can get an egg to be fertilized eventually by sperm. When there's not enough thyroid hormone, what we'll see is LH also tends to be low. You don't really see that spike mid-cycle, and then there's not a signal to the ovaries to appropriately release an egg. You'll see anovulation or lack of ovulation, or an irregular cycle. This makes it very difficult to conceive. On the flip side of things, if you have overproduction of thyroid hormone, this is called hyperthyroidism. As you can imagine, everything metabolism increases. You may have unexplained weight loss, you may have increased appetite, you may be extremely hot or sensitive to heat, more sweating, you may see heart palpitations, nervous energy or nervousness and anxiety, and so forth. You also may see scanty periods for women that have hyperthyroidism, and kind of energy that's nervous, wired energy. As it relates to the reproductive tract, you'll see elevated LH that tends to stay chronically elevated throughout the entire cycle. If that's happening, we don't have this big surge of LH, and again, there's not a really great signal to the ovaries to release the egg. So ovulation can either be absent with anovulation or irregular. So as you can see, this is a really key piece to make sure that you're looking at if you're dealing with any infertility issues. And even if you're not, it's a good thing to know about before conceiving. So pre-conception, you should be getting screened for your thyroid. In particular, it's important because once we become pregnant, the thyroid and metabolism increases to help support the production of the fetus. And this is really key for supporting brain health of the fetus. So making sure that not only while you're pregnant, but also pre-conception, your thyroid is being supported, as well as into the early weeks and throughout pregnancy. Now, other issues can happen with thyroid called autoimmune thyroid issues. And there's two major types. The first has to do with underproduction or hypothyroidism, as well as an autoimmune condition. This is called Hashimoto's. So what's happening here is that there's underproduction of thyroid hormone, but your immune system is also flagging or tagging different areas in the thyroid. It could be the receptors of the thyroid, different enzymes, or the gland itself. What happens with this is if there's any kind of immune response and the immune system is upregulated, it's going to go after anything in the body that is tagged or flagged. So you'll eventually start seeing damage to the thyroid gland when there's any kind of immune response. Obviously, this is not good. We want to help support and control and modulate that immune system so that's not happening, as well as support the thyroid itself. So autoimmune thyroid issues, we have to remember, are an immune system issue related to the thyroid. On the flip side, if you have an autoimmune where there's hyperthyroid picture, that's called Graves' disease. Again, you're going to have overproduction of thyroid hormone, and you're going to have your immune system that's tagging different areas of the thyroid, causing damage. So really important to make sure that you're looking at these, screening for them well before getting pregnant, and understanding what's going on in the body. Another important thing to note is that there's a huge correlation between a common issue called PCOS, polycystic ovary syndrome, and thyroid dysfunction. So in PCOS, women have many cysts that are around the ovaries. This tends to be a hormonal imbalance that's related to insulin resistance, blood sugar, as well as an imbalance in the androgens, which is the male hormones like testosterone. They may experience weight gain, anovulation, heavy menstrual cycles, sometimes no menstrual cycles at all, as well as acne, hair growth in areas that it shouldn't grow, like the chin and the chest. So some similar symptoms to thyroid issues, but it's important to make sure that you're looking at thyroid function in these women as well, because they could be dealing with both issues. And helping support the thyroid can really help them support their PCOS picture. So that's a little bit about the thyroid, what it does, different issues that can happen with the thyroid. Next, we're going to talk about different lab tests to look at, making sure that you ask your doctors for the appropriate testing. And the next video after that, we'll talk about all the different treatment considerations, supplements, herbs, food and diet, and stress levels. So stay tuned and we'll talk to you soon.